Welcome to Mo Health Media. My name is Guy Danhoff, and we have a very special broadcast for you. As most of you know, recently, especially as of yesterday, there was a lot of breaking news regarding COVID. And today I'm joined with special guest, Dr. Rachel Orscheln. She is with Washington University as part of the Pediatric Infectious Disease Specialist and right there at the Children's Hospital. And Rachel, thank you for joining us today.
Thank you so much for having me.
So I also understand that you do some projects with the CDC. So you're pretty active with all that's going, or a lot that's going on with the CDC, especially related to education, correct?
Well, I've worked a lot with the return to in-person learning, and that's been in collaboration with a lot of different groups, including Education Plus. And we also have a project with the CDC. My coworker and is Dr. Jason Newland, who's really taken the lead on that project.
Yeah, I'm very familiar. A lot of us are familiar with his work because he does a lot of work in combination with Misha.
Yes.
He's done several statewide, town hall meetings that you've put on, multiple times. So with that, we're going to dive right in. There's so much news going on right now, Dr. Orscheln, and I think the first question is, could you bring us up to speed on what is going on? And the media is reporting this as a strain, but I guess from insiders, they're telling me it's really not a strain at this point. It's a viral variant. And maybe if you could explain that to us, what that means, and currently, where are we at with that situation?
So, when viruses are transmitted in the community, and this is the same is true for the novel coronavirus, there are genetic changes that take place over time, and we expect this to happen. Certainly, at certain times, there can be changes that are predicted to change the way the virus operates, and that is what is being proposed or what is suspected with some of the viral variants that are circulating throughout the world. And in particular, there was a viral variant in the UK that was felt to be associated with a spike in cases or an increase in community transmission. And the reason why that was suspected was based on a number of different factors. One was that particular viral variant made up a large proportion of the new cases in the community. And also it appeared based on contact tracing that if a person was exposed to that particular viral variant, they had an increased risk of becoming infected. So it went from about a 10% chance to a 15% chance. Now, when we look at these viral variants, we also want to say, does it seem likely based on the changes in the genetic code that they will be more transmissible or more infectious? And there was some belief that based on the types of changes that occurred, particularly in the viral variant in the UK, that it was likely to potentially bind more tightly to the receptor. So it was a little bit more sticky when you came in contact with it, essentially, on the way that it entered the body. And so those, because of those changes, it was suspected that that strain would be more infectious. That variant.
Correct. So is it true though, because this was reported right in December, that it's hit the United States? I mean, is that true? And is it something that we need to be concerned about?
Well, I think anytime we have a chance that a variant is likely to potentially infect more people, even if it's a small percentage increase, then we do have to worry as a population that
Right.
will result in an increased number of cases, particularly in areas where we're already seeing widespread transmission. Even if it's just a 50% increase chance that any exposed person will become infected, that's a large number when you're talking about the population.
Right, gotcha. One of the things that was also reported, again, as breaking news, has to do with the increase in children getting COVID, as what was reported, at least on NBC, before reports showed, 2 out of every 100,000. Now it's at 17 per every 100,000. I was wondering if maybe you could speak to that, to that change.
Well, certainly as we've seen more widespread community transmission of the novel coronavirus, we have seen an increase in the number of children that have been infected over time. And so that is sort of an expected when you have a population and you have community transmission. We will see more and more children becoming infected. And some small percentage of those children will become hospitalized. So over time, you may see an increase in hospitalizations among children as well. In our area, we haven't seen necessarily a dramatic shift in hospitalizations. We know that most children who are affected will have either an asymptomatic or mild infection, but rarely we do see children who become more seriously ill and need to be hospitalized related to infection with the novel coronavirus.
Sure. With that being said, I know you probably get asked this question maybe more frequently than most. As you know, all the schools in St. Louis either started a week ago or started this past Monday. And the questions that's coming up based on what's going on with the latest trending data on COVID-19, do you think that we'll be headed to a situation like we were last spring where schools need to go virtual?
Well, when schools closed last spring, nobody really argued with that as a way to try to limit community spread, because all of our previous preparations related to pandemics had to do with influenza. And we know
Right.
that children are kind of the main driver of that infection, and really closing schools for influenza can actually reduce transmission in the community. But what we've learned over time is that schools do not appear to be a site for widespread transmission of the novel coronavirus. In fact, it appears that being in person in school actually reduces your chances of acquiring infection with the novel coronavirus. So at this time, we feel that it's very safe for students to be in school. Now, that's with the caveat that it's really important that schools have mitigation strategies in place, which really focus on screening students for symptoms of illness, masking, using some degree of physical distancing at 3 to 6 feet, and avoiding crowding and certain gathering situations.
Well, that's actually really good to know. I know you've been very consistent about that. So what I'd like you to do is maybe take us back to March 2020, because I know you provided a lot of data at that point, and kind of what have you seen in the trending data as you've been looking at this as it pertains specifically to, school districts and schools and students, as well as teachers and staff?
Well, we've just really had a lot of time to gather information. The first information that we had really in the spring and into the summer came from overseas, where schools had returned to in-person learning. And what we saw was that schools that operated with mitigation strategies in place really saw very little evidence of of school-based transmission. And in most circumstances, there wasn't an increase in community transmission related to schools reopening. And we've seen that replicated again and again in studies. Most recently, the CDC published a report from Mississippi that looked at risk of acquiring infection with the novel coronavirus and what your risk factors were. And they really showed that being in person for learning reduced your risk, or you had about a 50% lower risk of being positive for the coronavirus compared to students who weren't in person. So this information has continued to emerge that the school environment, when operated properly, really is a safe place to be and really shows very little evidence of secondary transmission of the novel coronavirus. Now, we know when we see increased rates of community spread, we will see students who are at school who later test positive, and then we need to do contact tracing. And that, again, is another really important part of our strategy to keep schools safe, is really identifying students who are positive and identifying people who are close contacts for careful follow-up.
Thanks for sharing that. And with that, I want to follow up because, as you know, there's a lot of student athletes, all the way from, middle school, high school, certainly into the colleges. And I was just wondering, I know that Jason in particular has put together a resource in conjunction with Misha. And basically what I'd like to ask you is about when kids return from COVID, what is the safe return protocol, whether you're going to go back into physical education, your sport, or even recreation?
Well, it does appear for children who are very mildly affected, they can just have approval from their primary care. So children who are asymptomatic when they test or just have very mild symptoms, then being approved by their primary care provider to return to physical activity would be appropriate. We do think for those children who are more severely affected with prolonged fever, certainly children who are hospitalized with infection with the novel coronavirus, and any child who had MISC, or the multi-system inflammatory syndrome of childhood, really require more careful follow-up. And those children should particularly be evaluated by cardiology to be cleared before a return for physical activity, particularly for older athletes.
Gotcha. So with that being said, my last question is this: is there been any, newer guidance given, whether it be from the CDC or some of the other groups, regarding safety precautions that, that we could be taking again within the school setting?
Well, I think it's really been fairly consistent. So the types of things that are really important for reducing spread, the kind of things we can do in the community, but we should also be especially vigilant about doing them in school, include, staying home when sick, screening students to make sure, and faculty to make sure nobody's coming to school while they're ill, really adherence to face masks. There was a recent report from North Carolina looking at transmission in schools, and what they found was that occurred almost exclusively when face masks were absent. Now, we know in certain circumstances that's really necessary. We have to eat lunch. And so really using mitigation strategies is really important. But we do see transmission when people don't wear face masks. And then using physical distancing, 3 to 6 feet, generally speaking, is really important. Using good hand hygiene, avoiding big crowds of students. These are the ways we can really keep schools safe. And that really has been consistent throughout the pandemic.
And Dr. Orscheln, thanks again for your time. And we want to thank all of you for watching right here on Mo Health Media. Thank you.